We should have a few more folks joining us. We'll go ahead and get started. I believe I know most everyone on this call, but again, for those of you I haven't still had the pleasure to meet in person, my name's JJ Jones, and I serve on the staff team along with my colleague Morgan Young and several other folks for the National Institute for Animal Agriculture. And we appreciate you all taking some time this afternoon to join us for this member and partner paradigm webinar. As many of you know, we send out a monthly newsletter for members only entitled Paradigm. And from time to time, we decide to do it more as a virtual meeting or gathering of casual conversation around a topic of interest. And several years ago, through investment from our partners at the Association of State and Territorial Health Officials and CDC, as well as the Cattlemen's Beef Board, the National Pork Board, and several other organizations, we began a convening and conversation that adds on to our annual antibiotic symposium in an engagement with scientists and researchers and subject matter experts at the Centers for Disease Control and Prevention, pairing them up with farmers and ranchers and veterinarians and others within the animal agriculture space to continue our work in terms of antimicrobial stewardship and resistance under the One Health umbrella. And so, as many of you can imagine, the last several years, we have done this engagement virtually, like so many things. But this past August, we were able to return to an in-person engagement. And we were limited in terms of the number of folks who could travel, just from a space constraint, as well as health and safety protocols on the CDC campus. But we all felt it was a great conversation, a great day and a half of collaboration and networking and relationship building. And so we wanted to, in advance of our 12th annual antibiotic symposium coming up here in a couple of weeks, convene a small group of members and partners of NIAA to share insights from that visit and where that takes us from here. So joining me today are probably some familiar faces, and I'll ask each of them to share a brief introduction here in just a moment. But we have Andy Bishop, who is a farmer and rancher from Kentucky, as well as an ag lender, and serves as an officer of the Cattlemen's Beef Board. And then we have Dr. Megin Nichols, who grew up on a ranch in New Mexico and went on to earn her degrees in veterinary medicine, and now works with the Centers for Disease Control and Prevention in the foodborne and waterborne illness spaces. So very knowledgeable and a great friend of NIAA and animal agriculture, in addition to One Health and human health. And then Dr. Heather Fowler with the National Pork Board, who not only holds degrees in veterinary medicine, but also public health, and is a true One Health champion. So with that, and I will encourage all of our members and partners who've joined us today to remember that this is going to be, even though it's virtual, more of a casual conversation. So we don't have any slides to share. We're not doing anything too formal other than just having a conversation. So obviously I have a few questions or conversation starters to get us going this afternoon, but then I'm sure Heather and Megin and Andy would love your questions or comments for reaction as well. So we'll make sure, and you can do that by raising your hand or entering a question or comment in the chat feature, whatever you're most comfortable with. But let's begin with, and maybe Heather, I'm going to look at you first, because you're our One Health champion on this call, if you will. I know we all are, but I know that's an area that you're extremely knowledgeable and passionate about. And so as we think about engagements between organizations like National Pork Board, NIAA, CDC, and others, why do you see that as an important factor in a One Health conversation and a One Health approach to topics like antimicrobial stewardship and resistance?
It's a great question, and I appreciate, and I love being referred to as a One Health champion, because I am a self-proclaimed One Health champion. I just hope other people recognize it as well.
You've taught me well.
Awesome. So I think in general, when we think about topics that can be, polarizing, that that folks can get really passionate and emotional about, that we need to make sure we continue to keep communication and information flowing across different sectors. Within the One Health definition itself, it talks about communicating and collaborating across human, animal, and environmental health in order to address issues that span those spaces. So I think as you think AMR, you immediately think public health, you think local public health, you think state departments, you think CDC. If we're and knowing that in the human health and the animal health or veterinary space that we use antibiotics as well, I will say representing animal ag often feels like there's a lot of finger pointing in our direction, and by leaning into the One Health conversation, it allows us to be part of the solution as well and feel less defensive participating. So I think for all those reasons, from a One Health perspective, needing to collaborate and even needing to innovate. I think there are some recent examples in the food safety space that I think could really benefit from a One Health conversation, and making sure that the solution is a shared solution that we're all in agreement of. There was the FDA public meeting, one person mentioned, sometimes you might have different agenda and therefore might have a different solution in mind, but it's important to bring that to the table, have that conversation, and if you're not happy with the solution, explain why. So I think One Health really is the answer to addressing a lot of these issues because it encourages collaboration and communication across those different sectors.
And I love two words you just said there in terms of collaboration, communication, and having that open dialogue back and forth amongst whether it's animal health leaders, human health leaders, environmental, plant health leaders, et cetera, because that's when we're really going to truly find solutions and make a difference. So I love that. Megin, if I can, we'll flip over to you. And you know, you bring a unique perspective, I believe, to this conversation, in that you grew up on a farm and a ranch. You studied veterinary medicine, obviously, worked in that space in private practice for a little while, I believe, before joining the CDC, where now you engage with folks truly from, yes, still animal health, but also human health and environmental health, and so many leaders in this space. From your perspective, why is it important to have stakeholders like Heather and Andy and their colleagues come to the CDC campus and engage in dialogue and experiences as we work on, again, One Health and also antimicrobial stewardship and resistance?
I appreciate that, because I think one of the things that it brings to us is the opportunity to engage in dialogue and collaboration outside of any ongoing discussions about food safety work or web page. It's just an opportunity to get together in the same room and talk. And I recognize that many of my colleagues have experience in agriculture, food safety, or food industry, but many of them also do not. And so when they're thinking about a food safety topic or a public health topic or an issue with an outbreak, one of the things that they might look at doing is making a recommendation. And maybe it seems so simple. If we just do X, then the outbreaks would stop and everything would be better. And while those types of ideas are great and are aspirational, what we really need is that dialogue and that conversation from those who have boots on the ground to say, I hear what you're saying, but let me tell you what that looks like in my world. Let me tell you about the effort that would take. Let me tell you about how, yes, that is definitely possible. And we should think more about that. But I think it really grounds us in some of the realities that are outside of our field of expertise and broadens our understanding and our curiosity, really, to ask the questions and get some of that ground truth. And I will say one of the unique things about this organization is I feel like it has really opened up an opportunity for honest dialogue. I feel like there's no underlying agenda or items there. It's really just free-flowing thought, dialogue, and conversation, and an opportunity to see people as humans and learn a little bit more about where they grew up and what their background was, things I never expected, to form that relationship and then to build upon some of that. And I think it's really made our science better at CDC. I think it helps us to be able to reach across, when you have that relationship, when you're not in the midst of an investigation or an event or something that's really concerning, it helps to have that relationship that's solidified so that you can reach out via email and say, yeah, we see this too. This is an issue. Let's discuss.
No, that's great. And Obviously, we like to hear that those relationships are either being fostered or built upon, because especially when we have topics that can be as complex and at times controversial, like antimicrobial stewardship and resistance, it's nice to have faces with names. And as you highlighted, remember that it's all people who are involved, and we all have ideally the same desire for continuous improvement and better outcomes. Now, how do we work together to do that? So speaking of boots on the ground, folks, we also have Andy Bishop, who, as I mentioned, farms and ranches in Kentucky, as well as serves as an officer of the Cattlemen's Beef Board. And the Beef Checkoff, Andy has been a longtime partner and investor in NIAA's work in this space. And obviously, you've had the chance to go to CDC and to host folks out in the countryside and visit with them. Why do you see it's important that farmers and ranchers engage firsthand in experiences like what we had in August?
That's a good question. I think listening to what Heather and Megan both had to say, there's several key words that were brought up, and one was defense, one was communication, collaboration. But basically, at the end of the day, being on the offense, so being involved in these conversations allows farmers to create a real factor for those people who may not be seeing what we're doing day to day on the operation at home. And so, it's easy for us to, as a farmer, to think, wow, everybody should know what we're doing. We're taking care of our animals. We're doing this, we're doing that to make sure that those animals live the best life that they can, but also that we're stewards of what God has blessed us with. When I've attended CDC, inversely, those folks down there would say they ought to be able to see what we're doing from a scientific research standpoint to protect our food supply and what we're doing. And so putting all these groups in the room together, to me, allows us to see what each party is doing, and that at the end of the day, we're all in the same fight together. And that is, how can we create a safe food supply for all Americans, but for the entire world? And as a producer, how can I be a part of that? For Megan, how can she be on the scientific portion of that to make sure that all of those things come into play? And the communication piece is very vital for consumers to be able to understand that have not, I guess, been on the farm, but also been involved in these things that we do day to day. And so it's important for us. And I see Ryan's on the call. Ryan Goodman has done a great job of promoting animal agriculture and what we do and telling our story, but also teaching producers how to tell our story and communicate a little better. But the opportunity for producers to be involved in these conversations are vitally important moving forward.
Excellent. No, thank you. Great insights. I always like to start with why it's important and why we have these types of conversations. I'd like to shift a little bit to maybe a bit retrospectively to then look forward. And my thinking there is, all of us have been involved in these conversations for several years now. And I'm curious how you all see the conversation evolving, or how has it evolved from maybe when organizations like NIAA began our antibiotic symposium a decade plus ago to today. What shifts in attitudes or knowledge and insights have you seen within your respective sectors of animal agriculture or the food system? And Megan, maybe Dr. Nichols, maybe we'll start with you. How have you seen the conversation shift or change over time?
Well, I have to say quite a bit. I think that every time we have these conversations or these opportunities to engage, the first thing I hear is, do you think I could go onto a farm? Do you think I could go and learn more about what this is like? And because I think it just broadens their horizon so much that there's interest in engaging. And then I think the next thing that is said is, I had no idea what was already being done in this space. So an acknowledgement of something that Andy said, that this is a lived experience and an effort that occurs and is ongoing every single day. There's efforts around this. And in conversations that Heather has brought to the table with some of the representatives from the pork industry, also how complex some of these efforts and initiatives are. I mean, they involve collection and analysis of a lot of data. And so I think our CDC scientists, including myself, I'll use this word, we have a little bit of an opportunity to nerd out and really get excited, not only from the opportunity of broadening horizons and curiosity, but hearing that there is work underway and learning more about that type of work, whether it's, how a veterinarian that a producer works with has designed a plan and how that helps with antibiotic stewardship every single time they're looking at a sick animal and really wanting to care for the health or welfare of that animal. Or it's talking with one of the pork producers about, collection of complex data and looking at trends over time, which is something that we have a appreciation for here on the data side as well.
Sure. And Andy, in a similar vein, as you think about either on your farm or ranch, or as you've visited with fellow producers over the years, how have you seen producers' knowledge of antimicrobial stewardship and resistance change, or their knowledge of or attitudes towards collaboration and working in a One Health space? How has that evolved and changed over time?
I think originally that conversation was kind of hands off, to be honest, at the farm level, producer level, out of fear. Not that we were doing anything wrong, but that we were afraid that someone was going to start pointing the finger at us more than they already were. And so most producers and farmers and ranchers were afraid to have that conversation with people outside of our industry. And I guess it was naive for us to think that way at the time, but we'd always been taught and kind of had that preconceived notion that those folks were out to get us, and that we had to protect our interest, instead of thinking proactively in that, hey, we can have these conversations and share what we're doing, the good things that we're doing, but also learn how to do things better than we already have been. And how can we continue to grow this industry and do the things the right way so that we can have that image that is portrayed as these guys are keeping everyone's best interest in their minds. And so I think that dynamic, that paradigm has changed a lot just in the last few years, especially. Conversations like we're having today continue to push that forward. And I think as more producers like myself get involved in this, other producers begin to say, hey, they're not the big bad wolf out there. Let's tell our story, but let's work together on doing things better and let them help us tell our story. Because when it comes to consumer, and I've talked about this multiple times, when a consumer sees the CDC label behind information, they begin to immediately trust that information and that source. And that's very important. So why can't we be a part of that conversation and have that affiliated with what we're doing day to day?
For sure. That's a great point. As someone who grew up on a farm or a ranch, I think you're spot on that many times we're taught just to do our job and let other people worry about what's happening in various conversations off the farm or ranch. But the paradigm has definitely begun to shift, and it's exciting to see that happening. Heather, from your perspective, again, working on behalf of farmers and ranchers, how have you seen the conversation around antimicrobial stewardship and resistance changing or evolving over the last several years?
Yeah, to echo what has already been said by both Andy and Megan, I think, there were folks that were definitely on the defense initially, but folks that also were kind of curious about learning more and nerding out a little bit. The one thing I will say about One Health is it's a delicate balance that we're trying to do, and it sometimes comes down to the individual, and it can be delicate in that way. And that maybe there were some players and positions that negatively shaped the concept of One Health or negatively impacted. Going even before my time in the National Pork Board, I worked in Washington State, and we had a One Health effort there, and there would be one person that maybe misinterpreted or did something against the group, and I could see the effort crumbling, right? And so then you had to revitalize it and remind folks of when we said communicate and collaborate and not finger point, let's not do that. So I think early on it was, well, you're saying it's One Health, Heather, but they're also saying it, and I don't like the way they frame it. And having to have those conversations with folks of, again, reminding them, hey, we're not finger pointing here. So I have seen some changes in terms of the people involved. And working with Megin, who's really collaborative. Well, if Megin was very standoffish and made it difficult, we wouldn't have that collaboration. So just a call out to the people piece and the people involved as well. I will say too, during my 5-year tenure here at the Pork Board, I've gotten more and more people, including senior leadership, to use the term One Health. The COO the other day said to me, Heather, One Health, right? That's One Health. And mind you, we've been doing it since the beginning of time. It's ingrained within animal ag in general. We're trying to produce safe, healthy, nutritious food, but at the same time needing to balance animal welfare, needing to balance the environment. All of those people, the people that work for us, keep them safe and healthy. We are balancing human, animal, and environmental health factors every single day. We may have just not called it that until recently. And so I'm part of the reason that if you talk to a pig farmer and they know One Health, that's because I've really been framing up what we're already doing and what we have been doing for a while in that way. So more folks that know the term, definitely the people piece, and needing to continue to grow the One Health approach over time.
And I think what I just heard there too, Heather, is one, like all of you said, we've definitely seen the conversation and the collaboration moving in a forward direction, but it's also the proverbial journey and not a destination. That we're probably never going to get to a space where we can just say, well, we've done everything we can on One Health. That as long as microbes evolve and become resistant, or as long as we have food safety issues and food in general, there's always going to be topics of conversation that need that collaboration. And you're exactly right. Sometimes we have to say a few things over and over to remind people that it's not about finger pointing, and it truly is about that collaboration. So I love that. Fair warning to all of our members and guests, we want to see your questions and comments as well. So please get those ready, because I have some in my back pocket here, but I always brag on our NIAA members that you all come up with questions or already have questions when we begin these types of engagements. But again, going around the virtual table here, based on our August engagement where we had farmers and ranchers and veterinarians and those who support via allied industry, what was an aha moment that each of you had? And I'm looking at my notebook, I had pages worth of notes during our time. So I may be challenging you to say, limit it to one or maybe two. But Andy, let's start with you. As you walked away from the conversations in Atlanta, the tours of the laboratories, what was an aha moment that you had that you'd like to share with everyone?
I think obviously my biggest aha moment was that at an industry level, Heather, Megin, myself, we are all working within our own circles on really achieving the same goal. But when we got into that room, we were more vested in what each other were doing than what I originally thought. And so the opportunity for us to work together more collectively to achieve that one goal, whether it's, One Health in this instance, it was obvious to me after really a few hours of being in that room that why are we not all already working even closer together to achieve this goal? And so I think that was probably the biggest aha moment is, you think CDC's over here doing their thing, the pork folks are over here doing their thing, and beef, hey, we're over here doing ours. But really, we are all so intertwined in what we're trying to accomplish that we should be working more closely together than we already are.
That's a great point, that sometimes we think we're maybe further apart or we're doing our own things. But like you said, once you get in the same room and start to have that open, honest conversation, we figure out, oh, maybe our priorities are more aligned, or we're working on similar activities more closely than we originally thought. Great point. Heather, how about you? What was your aha moment?
I guess to piggyback off of Andy's comment, just realizing that we were working on some of the same things. And for me, trying to think, how do we pull those together? So right now I'm the National Pork Board is part of the Foundation for Food and Agricultural Research, or FR's International Consortium for Antibiotic Stewardship in Agriculture. FRI-CASA is the full acronym. And just thinking, and there's representation from beef and others there, but just how do we continue to fold? So I'm thinking as a One Health super connector of how do I get NIAA in the conversation? Because we had a lot of conversation around how do we pool our resources? How do we continue to research this question around antimicrobial use and resistance? How do we continue to push the needle? Also hearing about some of CDC's social behavioral science work that they're doing. I think that was a big aha for me, and seeing it, fold into other areas. I think growing up, I thought of CDC as hardcore numbers, coming from an epi background, it was like, don't ask those qualitative open-ended questions. No one knows how to analyze that, but it gets into the human behavioral piece, and knowing that we're starting to see it here in the food safety and antimicrobial use and resistance space. So how do we continue that momentum, continue to bring all the different areas together and really channel those resources?
Yeah, I'm like you, Heather. Anytime I'm a ruminant nutritionist by training, and so I think of the bench sciences, but like you, the social science and human decision making is fascinating to me as we think. And of course, that's obviously close to what the pork checkoff and the beef checkoff do every day, because we're finally realizing that consumers, or humans in general, we all approach foods and scientific concepts and just life in general from different perspectives. And so having that social science background to figure out how people are making decisions, or how they're going to take recommendations from an organization like CDC is fascinating. So to borrow Megan's terms, I could nerd out on that science as well while we were there. Megin, how about you? As you and your colleagues, I know, have had several conversations post the August meeting, what aha moments jump to your mind?
Well, for the purposes of this call, I am impressed that Heather has managed to out-acronym us at CDC. FR-ICASA is pretty impressive, but I am familiar with the work of that group, and it also probably warrants a fancy acronym because it is impressive. I would say that in a similar vein, one of the things that we were really impressed by is to hear a lot more about the communication and education efforts that were going on in the industry. And CDC oftentimes is really wanting to get our science, our data, and our messages out into the world and into the hands of people that might find them useful. And in our presentation of some of these efforts, we got incredible feedback around efforts that were underway by others, and how some of the pieces that we had could fold into their efforts, and vice versa. Some of the things in the work that was already underway was really synergistic and was helpful for us to review here. So I think that was really an aha moment, is just to see the breadth and even the depth of some of the work on the education and communication side, and recognizing, wow, we really struggle sometimes to get this information into the hands of this group, and then also to get feedback as to, are we presenting the right kind of information? Does this resonate? Is it useful? And hearing about, wow, the groups around the table are the ones who can really help facilitate that, and also give us some really useful feedback as to whether or not the way we put things out is helpful and useful to them.
Selfishly, I'm so glad to hear that was an aha moment, because a number of years ago, I was involved in some consumer research where we were looking at how consumers looked for trusted information about foods, and unifying messages came out loud and clear, that it's not that consumers or shoppers are looking for the same story from every farmer, rancher, industry organization, governmental agency, but were there threads of unity or unification? And so what you just described, Megin, I think is a great step in demonstrating how we can continue to have more unified messages, so that as consumers are making choices about foods for themselves, whether they're looking at it from a food safety or a health and nutrition standpoint, an animal welfare aspect, whatever the case might be, they're hearing some unifying messages. So let's open it up to, we have several NIAA members who've joined us. Of course, we're recording this for those who can't be here, but who has our first question for Megin or Heather or Andy? I see several folks that I'm sure have questions based on knowing you and your backgrounds. Again, you can either enter it in the chat feature or unmute yourself. Okay, well, I'm warning you, or not warning you, but giving you heads up that please do that, because I only have so many questions, but I can keep asking questions. But well, I guess while we're waiting for our folks to enter their questions or form them in their mind, as we think about continuous progress in this space of One Health and antimicrobial stewardship and resistance, especially as it pertains to animal agriculture, what do you all see as next steps? What do you hope takes place either within your own organizations or collectively between the beef checkoff, the pork checkoff, CDC, NIAA, and others after our August meeting? And Megan, I'll circle back around and start with you on that one.
Well, I think some of it has already started. So Andy reached out with a really good question for us around some science. And what are some of the efforts to really understand emergence of antimicrobial resistance, impacts of antimicrobial stewardship in populations, especially over time? And it's a question that, you know, we ponder a lot, but I hadn't dug into for a while. So I was really excited. I'm really excited to dig into that a little bit more. I've started, you know, dusting off some literature and reading into it to see what is the latest and greatest that's going on in the field, and looking forward to circling back with colleagues to have more robust discussion about, you know, where are there some of the gaps in science and understanding in some of these areas, and where can we collectively come together to look at ways to understand what I think is a complex problem from different angles, to take a little bite out of the science, to see where we can contribute to that body of knowledge and really increase our understanding of some of this complex science.
Excellent. No, it is exciting, like you said, after the conversation, to see where there may be additional opportunities for collaboration, not just in knowledge sharing, but actually in some either collaborative research or supportive research and communication efforts. So that's excellent. Heather, how about you from your perspective? What comes next? How do we keep the momentum that was built and maintained from August going forward?
So one of the things I've been trying to do is connect NIAA to the FR group, at least give an overview of who they are, what they do. So kind of fold in. I've already given the group itself an update in terms of the producer visit. I think maintaining that cadence of either visit the CDC, do a farm tour visit of some sort. I think, as Megan mentioned, right, not all of us come from even the veterinarians come from a background where they've experienced animal agriculture, how animals are produced in the different species, right? I can speak to some species, not all. You don't want me touching your horses, trust me. You know, having those opportunity for continued learning for veterinarians, for other public health folks. The National Pork Board before COVID was doing essentially called public health farm tours. We'll start to do One Health farm tours here in the future, where we want to bring those folks out. So if we can continue to collaborate as each group, each sector starts to do those activities, fold in the other, you know, maybe Andy, you have no interest in learning about the swine side, but bring you in and see, again, continuing those conversations there and vice versa. So I think that barnyard connection, as well as bringing in other key stakeholders and folding them into our ongoing conversations, I think that's how you continue the momentum. And I definitely leaning on NIAA to really coordinate and convene, and some of those activities would be really helpful.
Excellent. No, and I like to, and my next question is going to be on this, of how we take this to the state or regional level as well, because obviously we're sometimes looking at it from more of a national or a larger scale level, but how do we get it back to borrowing Megan's term from earlier on, the boots on the ground type actual spaces? Andy, how about you? What do you see as next after the August conversations?
Well, I think I touched on it at CDC during our visit, but then also at our beef board meetings, and the fact that Heather's checkoff dollars, my checkoff dollars are diminishing every year, and the value of those dollars are going down. And within our respective industries, we're already doing these research projects, and kind of several of those are overlapping projects. And so moving forward, what I would envision would be a collaborative effort, a research project starting at birth at the farm gate, all the way through the entire system, through the entire food chain, and using a traceability type system to do a full-fledged research project from start to finish. So in our case, from pasture to plate, so to speak, where we're tracking that animal through the system, we're tracking these pathogens throughout the system to see where they're occurring, or things that we can be doing differently on different operations that maybe we're not having that incidence rate of a pathogen at the farm level. Well, why is this farm not having it and this one is, or, so on and so forth. But a collaborative effort where instead of doing 3 individual research projects, now we're doing one project and we're pulling those funds together. And then the last portion of that would be, let's communicate that to consumers across the world on what we're doing here in the US to create the safest food supply in the world.
No, I like that of, not only do you do the actual research, but then think about how it can be useful in terms of communication and engagement with consumers and other influencers in purchasing decisions, which, and we had several folks from qualified state beef councils and qualified state pork checkoff organizations express interest in knowing, well, how can they take this information and apply it to what they're doing in terms of promotion, research, and education. And I know Andy and Heather, both of you work with fellow staff members at the state level, or Andy, in your case, volunteer leaders, farmers and ranchers. How could you see a state applying information? I know, Andy, we had folks from Kentucky, and Heather, we had folks from Minnesota and Iowa who are on the farm or ranch or at the state level of research, promotion, and education. How could you see those folks either utilizing or applying what you learned from the CDC engagement? Oh, Heather, we'll start with you.
Okay, perfect. Yeah. So, I think again that that opportunity was great to bring those producers out, and as we continue that momentum to fold in other producers. So National Pork Board, similar to our cattle folks, have state associations as well, and our state associations were notified that we were pulling producers from those states so that they know that they can tap into them and then bring them into additional events or opportunities, kind of learn about their experience, and then develop their own events. For instance, in Minnesota, I know they've hosted their own farm tours. They brought human health folks in and had those types of conversations. And now they know they can tap Dr. Sprunk to fold in and to have those conversations as well. And so I think our state associations, and I will point out that our state associations at times give us ideas. They test it out at a small scale, and then we can apply them at the national level.
Sure.
We have an event we call Oktoberfest, which we had this year in September, so we had to change the name. But it's when our state associations come in and share the information on the different activities that they've been involved in, what worked, what didn't, all sorts of things. And they are doing some amazing work as it relates to building trust amongst the consumer. So not all AMR focused, but just really getting the word out and sharing the good story of pork. And then again, there's opportunities to fold in that AMR message as we conduct more research, identify more answers and things like that. So I think we have a really good partnership with our states and are learning from them. And I think continue to fold in that learnings from this recent event as well.
I love that. Like you said, it's definitely a two-way street in terms of giving each other ideas. And we do hope that this type of engagement between farmers and ranchers and veterinarians and CDC gives some folks ideas of how they could apply that at maybe the state level or more of a local level. But Andy, how about from qualified state beef councils or beef producers perspective as you think about it?
Yeah, and I think Heather covered it very well. And basically just adding on to that, I think every single qualified state beef council needs a participant in this program and this conversation and what we're doing, not only from a learning standpoint, but bringing together maybe some of the difficulties that they have within their states. Each, whether environmental issues are different in all these states. And so I think they can add value to the conversation, but also to take some of these learnings back to their states. And I think it is very important that we have a representative from each state beef council involved in this conversation.
No, we would love that. And I think you hit a nail perfectly on the head too there, that it can be unique to each state or region of the country too. And so having multiple folks around the table helps us figure out where there's some similarities, but also where there's differences in how we can adapt to those spaces. And so Megan, Andy set us up well to actually a question that just came in through the chat. Obviously, this year we were limited because of space and health and safety protocols, and we wanted to respect those. But if, as one partner in this engagement, how does CDC hope to see this expand? I know Andy just shared maybe it's getting at least a member from every state beef council or pork organization there, but how would you guys see success down the road?
You know, I think I have some aspirational ideas, but also some that I think are pretty simple. So, you know, I am really looking forward, as well as many of my colleagues from CDC are, to attending the NIAA Antibiotic Symposium that's coming up in November, and really engaging with others on a little bit more. You know, we've started some great conversations, but continuing to have those and continuing to talk with others. And then I think in subsequent years, really continuing the conversation with this group and utilizing a lot of different venues. So I really appreciate that there are virtual options. I know sometimes it can be, you know, tough to set aside some time to log in, but I think having those types of roundtables and bringing those different groups together around a certain topic to engage, continuing to have opportunities for staff to visit CDC and learn more about things, as well as for some of our CDC scientists to actually get out in the field and learn more. But I think really looking to plug ourselves into more of the initiatives that are ongoing, as Andy and Heather noted, I think synergistically by combining and pooling our knowledge and interest in a lot of topics, I think that makes it stronger. And then I'd probably just echo what they both said in that we're doing this at a national level to engage in this conversation. And I think that's really important to generate ideas, but doing this at the state and local level is also really impactful. And I know many of our health department colleagues and agriculture department colleagues are engaged in these types of efforts, but also have really amazing perspectives that they can offer by connecting locally.
I think that's a great point, that, as all of you have alluded to, but Megan, as you just hit on, that there are a lot of folks doing initiatives around One Health at state departments of public health or human health, and also in state veterinarians' offices, et cetera. And so it's not only looking at what can they engage with at a national level, but if their state already has a One Health initiative set up, how can they get plugged into it? Or if their state doesn't have a One Health initiative, how could they reach out to one of you or those colleagues or fellow members in a state that has an initiative to not recreate the wheel, but to build on what others are already doing? Let's see, I just saw a question come through. Well, and Dr. Jordan, as you know, I think everything's always safe to ask and appropriate to ask in an NIA meeting, because, as was mentioned, we just like open dialogues. But Dr. Jordan's question is around the understanding of Senator Gillibrand's office's bill around a One Health Security Act. And shame on me, I have not tracked this bill yet, so I don't know if others have thoughts or ideas about that particular piece of legislation, or if, since we don't have any policy folks on the line, it might be difficult.
It looks like Karen unmuted herself. I was just going to give a basic, general comment. Did you have something to add, Karen?
No, Heather, I'd really be more interested to hear what you had to say. The only thing I know, in the Animal Ag Liaison Committee with the AVMA, we just had some discussion about this, and I guess I think agriculture really needs to be looking at this, and I guess on the very surface, I look at it and I say, well, somebody's trying. But then when you dive in deeper, I'm not sure that it's the correct way to try, or so I'll shut up and let Heather see where they are on this.
I will say I haven't taken a deep dive into it either. So I was at the, I mean, sounds okay. It's the way it's written, it sounds very much global health security and kind of infectious disease, pandemic prevention, and then the call out to the One Health approach. So working collaboratively, which we did see happen with all sorts of organizations. Honestly, NASA was involved, CDC, other folks, CDC and their One Health office did a great job of coordinating. But that's all I know from the surface, just calling out global health security, infectious disease threats. Keeping in mind that, you know, as we look at zoonotic diseases or emerging infectious diseases, I should say, the majority of them in the past have been zoonotic, COVID included. So it can be, there's a potential that the species that we work with could be the host. And what does that mean for our industry if there were to be an introduction of a given condition? So something to keep in mind.
Yeah, I'd just encourage all of us to keep watching it and see if maybe we can somehow, our policy folks, really keep an eye on it and see how we can advise or strengthen it to really get it to have good meaning for and good response time and all that, because I think the effort's there, but it just, as I took a few notes, the 5 vice chairs, I wrote down 4 of them: Department of State, Department of Health and Human Services, Department of Homeland Security, and USDA, and then there's somebody else. And then 14 federal agencies. And so you get Department of Energy, Department of Treasury, Department of Defense, you know, and so then it starts looking so huge. But anyways, to me, I'm just wanting to make sure that the ag world knows that this thing's out there and that maybe we need to take a look and see what needs to be some guidance or input or to make it really do what I kind of think they're wanting to do, but it just don't seem quite right. For like what Heather says, you know what, something like 80% are zoonotic of emerging diseases for humans, I think have a zoonotic link or something. So I think there's a need, but I'm not quite sure it's right, set up right.
Well, it sounds like you said, Dr. Jordan, it may be a starting point. And then how do we all engage in the conversation to ensure that it achieves its desired purpose and that we're truly getting the One Health look at it, as opposed to maybe being too myopic or binary, etc. Great question. Call out. Yeah, sorry, Heather.
I was going to say maybe another the topic of the next call, if we could get someone to provide some in-depth detail of the act itself, and then have the conversation around that.
I like that idea. You know us, we're always about convening a call for educational purposes. Other questions or comments from any of our members who were able to join us today? We've got maybe a minute or two if there's any additional thoughts. I know we've covered a lot of ground, but we don't want to shortchange anyone. Well, with that, obviously, hopefully, you know how to get a hold of Andy and Megan and Heather. And if you have follow-up questions and don't have their information, we can make sure and find a way to connect all of you as appropriate, because obviously that's a big part of what NIAA is always working on, is how do we connect interdisciplinary folks in animal agriculture so that we can continue to have these collaborations and shared learnings. So I very much appreciate everyone taking the time to join us. As was mentioned, we've obviously recorded this session, so whether it's you as a member that want to go back and listen to it, or if you have fellow members, we know we have some folks who weren't able to make this time work but would like to listen to the recording, so we'll have that available. And then, as was mentioned, thank you to Dr. Megin Nichols as one of our co-chairs for the event. We have our 12th annual antibiotic symposium coming up here in just a couple weeks in Alexandria, Virginia. So I believe most on this call have already registered and planned to be there. But if there are those of you who have not, or you know of colleagues or friends who would like to engage in this conversation, Dr. Nichols and her fellow planning team members have put together a great lineup of speakers and subject matter experts for us all to engage with. And obviously, Dr. Fowler was on that planning team as well. And then Andy Bishop and the Cattlemen's Beef Board have been a longtime supporter through the beef checkoff of that program too. So 3 individuals that have a rich history and passion for the One Health space and antimicrobial stewardship and resistance as we continue to move animal agriculture forward. So with that, Andy, Megin, Heather, thank you so much for sharing not only your time with us this afternoon, but your insights and expertise as we continue this conversation. And as Heather alluded to, we'll always be on the lookout for additional topics. But if any of you have thoughts or ideas on what that should be, we're always happy to convene a virtual conversation like this. And with that, we will thank everyone and wish you a great rest of your afternoon. And many of you we will see in Alexandria in just a couple of weeks. Thanks, everyone. Have a great day.